Hello, hi, my name is Jennifer, and today I will be completing an exam on my patient Sheena. This exam will consist of the abdominal exam, neurological exam, as well as the musculoskeletal exam. Sheena, can you state your name and that you give consent to start this exam?
I'm Sheena and I give consent.
Okay, I'm going to start off with the abdominal exam. Before doing this exam, I did have Sheena empty out her bladder since we'll be palpating her abdomen to prevent any discomfort. Sheena, can you lay down, please? To start off the abdominal exam, I'm going to first assess Sheena's, inspect Sheena's abdomen. Sheena's abdomen is flat. There is no bulging around her umbilicus or anywhere else in her abdomen, which would be a sign of hernia. There is no excessive striae, would be a sign of Cushing disease, and there is no pulsation, would be a sign to prevent any ruptured aorta. I am now going to use my stethoscope, the diaphragm part, to auscultate Sheena's abdomen. I listened to about 5 to 34 borogimis within a minute, and Sheena's abdomen is normal active. I am now going to listen to her arteries. I'm listening to the aortic artery, her renal arteries, the iliac right below the renal, and then at the femoral triangle, I would listen to the femoral arteries. I didn't to assess for any bruits, which I did not hear. If I did, that would be a sign of turbulence, which would be abnormal. Now I'm gonna start off with percussing Sheena's abdomen. Doing percussion, if I hear any high-pitched sounds, that's tympani, and dullness will be around any organs. The only place I heard any dullness was on her right upper quadrant, which is where the liver is. Everywhere else, I did hear tympani. Now I'm going to percuss to check for the size of the liver and the spleen. I'm doing the percussing the liver right to the mid clavicle line on the left side, right beside the umbilicus and below the nipple line. Sheena's liver is about 6 to 12 centimeters long. Now on the right side, I'm going to be listening to percussion to see if for the spleen. I did not hear any dullness around that area, which is a normal finding. If there was dullness, that would be a sign of an enlarged spleen, which we do not want. Now I'm going to start with palpating Sheena's stomach for light palpitation to check for any pain or tenderness. At any point, if you have any pain or tenderness, please let me know. Any pain?
No.
Okay, now I'm gonna do deep palpitation to assess for organ size. And any rebound tenderness will be a sign of peritonitis. I'm going to do the hooking mechanism to check for Sheena's liver. Sheena, can you take a deep breath, please? Okay. Sheena, can you take a deep breath? When I had Sheena take a deep breath at her right side to feel the spleen, that was now palpable, which is a normal finding. If I was suspicious of an enlarged spleen, and if I couldn't feel it in this position, I would have Sheena turn to the side and flex her knees. Now I'm going to assess for the aorta. I did inspect and I didn't see any excessive pulsation, which means that I could, and I didn't hear any bruits, which means I can go and assess for the size of the aorta to prevent any rupture. Sheena, take a deep breath. Okay, the aorta is about 3 centimeters. And you can sit up. Can you turn to your back, please? Okay, now I am going to assess CVA for any tenderness around the kidneys. If I'm palpating this area and I feel an enlarged kidney, that would be an abnormal sign. I'm now going to use the underside of my hand to strike Sheena's back. Any tenderness?
No.
Okay, this is done to assess the kidneys for any pyelonephritis, which wasn't felt. You're all set, you can stand. Now I am going to complete the musculoskeletal exam. I'm going to do it at 3 different stages. I'm first going to inspect Sheena's skin to any unevenness in her back, hips, and shoulders, any atrophy to her extremities, as well as any redness or swellingness to her joints. I'm going to start off with Sheena's back. Sheena's back is symmetric. Her shoulders are even. Her hips are even. There appears to be no mass on her area. And because her back is symmetric and even, this would be, if her shoulders weren't even or her hips, I would question scoliosis, which will be an abnormal finding. I'm now going to check to see it at the side. If I see a outward curvature in her upper back, that would be a sign of kyphosis, which would be an abnormal finding. Her neck is also symmetric. There's no lumps or mass. Color is appropriate. I'm assessing her bilateral arms and shoulders. There is no atrophy. There is no mass or any abnormal discoloration. I'm going to assess Sheena's elbows. There is no redness or redness with sign for erythema or any swellingness. Her wrists, there's no redness as well. Her fingers, there's no discoloration, redness, or erythema. The other side of her elbow, the same. No atrophy, no redness. Her fingers, no redness, no swelling. Now I'm gonna assess her hips. They appear to be even. Her knees, by assessing them, they appear to be even as well. No redness over her area, no atrophy to her lower legs. Now I'm gonna go and palpate these areas. Palpating Sheena's back. There's no lumps or mass. I'm palpating the sternal vertebrae, which is normal. There's no bulging disc. Palpating her hips. They're even. At the greater trochanter, it appears to be even. Her shoulders, the ligaments are intact. There's no hees or crepitus felt. Her elbows, palpating. I don't feel any synovium or bursa, which is, if I did feel that, that would be an abnormal finding. Palpating around her wrist for any snuff box, which is normal. Palpating the lateral and distal joints of her finger for any redness, swelling, which could be an indication of either rheumatoid arthritis, osteoarthritis. I'm doing the same thing on the other side. I'm palpating her hips for evenness. I'm also palpating her knees for any swelling, which is, especially if it's any uneven swelling as well, that will be a sign for rheumatoid arthritis. Her feet, her ankles, there's no swelling on that. Now I'm gonna move on to the range of motion of the musculoskeletal exam. This will consist of flexion, extension, abduction, adduction, internal rotation, external rotation, supination, pronation, eversion, and inversion of different parts of Sheena's body parts. Her neck, I did palpate that area. There's no abnormalities, no masses as well. Sheena, I'm gonna first start with the spine. Sheena, can you follow these directions? Can you lean forward? Can you lean backward? I'm gonna support her. Can you lean side to side? Side to side, perfect. I'm gonna hold on to your hip and I want you to twist. Perfect. So that completes the for the spine. For her neck, can you lean forward, backwards, side to side? Can you have your ears touch your shoulders? The other side. Perfect. For your shoulders, can you lean forward, backwards, up, to the side. Can you bend at your knees? I mean at your elbows. Just moving your shoulders. Can you go outward, inward? And can you turn around, touch your back with the other arm as well? Perfect. You can turn back around. For your elbows, can you lift them up, down? Can you also turn hand out, quick, fast? Perfect. Your wrists, I want you to put it down, up, to the inwards, outwards. Your fingers, can you spread them apart, bring them together in a fist, spread them apart again. Your thumb, can you bring it in, out, down, up, and touch each finger? Was anything abnormal?
No.
Did you feel any pain?
No.
Any discomfort?
No.
So now we're gonna move to the hips. For the hips, can you each leg swing forward and backward? Perfect. The other leg, forward and backward. Can I have you swing inward, outward? The other leg. Perfect. And can you lift your leg up, turn it to the side, inward, and then outward? Perfect. The other one as well. Inward, outward. Perfect. And then Sheena standing, her knees, that would be actually extension. Can you sit down for a second, please? Can you kick your knees out? Perfect. Kick your other knee out. Perfect. If Sheena was unable to kick her knees out, that will be a sign that there might be a MCL tear. Now I'm gonna go to the ankles. Can you flex down, up, inward, outward? Perfect. The other one, down, up, inward, outward. 1 second, I'm just gonna move the camera down a little. Can you do that again? Down, up, inward, outward. Perfect. Down, up, inward, outward. Now I'm going to check strength. Sheena, can you, this is all done against resistance. Can you pull, push back? Perfect. Shrug your shoulders, push down, turn your neck towards my direction. Perfect. Perfect. Your elbows, can you push up? Perfect. Perfect. For the hip, can you push out? Out. Perfect. Push in. Perfect. Ankles, can you push, you can do it together, down? Perfect. Up. Perfect. Your knees, can you push up? Try to push up against my resistance. Perfect. Again. Perfect. So this completes the musculoskeletal part of the exam. I'm gonna also start with the neurological exam. I am going to assess Sheena's reflexes. I'm going to first start with the check-in her biceps. Her biceps, tricep, brachioradial on both sides, bicep, tricep, brachioradial. Her patella, perfect, perfect. It should be a little up to see any jerky moving, perfect. Her Achilles, behind the tendons, perfect, perfect. I'm now gonna check for Beninsky. If there was any dorsiflexion, that will be an abnormal finding, which there wasn't. I'm also now going to, everything was a +2. If her reflexes were absent or diminished, that wouldn't actually necessarily be an abnormal finding because I can use reinforcement to elicit those. For the upper extremity, I'll either have Sheena clench her teeth or press her knees together. And for the lower extremities, I would have Sheena pull apart her arms to actually check if there's any abnormality in reflexes, we will actually look for any asymmetry. I'm also now going, and if it's a +4, that'll, any reflex that's a +4, which is hyperactive, that'll be a clonus. I am now also gonna have Sheena do some coordination. Sheena, can I have you flip your hands back and forth real quick? Can I have you lean back and your hands down your shin? Your feet down your shin, sorry, like this. Perfect. Another one. Perfect. So during this is coordination, it is expected that the non-dominant hand will be slower than the dominant hand, and the lower extremity coordination will be weaker, slower than the upper extremities. Now I am going to test Sheena's gait. And also during Sheena's range of motion, everything was a 5 out of 5. All her range of motion and her strength. You can stand up. I'm gonna have Sheena walk in a normal gait. You can walk to the camera, can walk backward. This is just to assess baseline. And during her walk, I'll also check for strength in her hips as well during her weight bearing. Sheena, can you walk with one leg in front of the other? This is the tandem walk. This tests for cerebellum function or any posture, her posture senses. You can sit. I am now going to test the Sheena's cranial nerves. I'm going to start off with testing cranial nerve 1, which is olfactory, and that's sense of smell. Before I do that, Sheena, can you press on each nose to check for patency? Perfect. I'm going to have you close your eyes. Can you press on one nostril? Can you tell me what this is, the smell?
Peanut butter.
The other nose? What is this?
Peanut butter.
Okay. Now I'm going to check for cranial nerve 2, which is the optic nerve, cranial nerve 3, which is the oculomotor, cranial nerve 4, the trochanterior, and cranial nerve 6, which is the abductions. I'm going to first abducens, which I'm going to start with cranial nerve 2. Sheena, can you, I'm going to use the snail test to check for acuity. Can you close one eye, please? Can you just, this line, please?
FPH.
Can you close the other one?
FPH.
Okay, Sheena has a vision of 20/20. Can you close one eye at a time and follow direction? Just look straight at the same eye as mine. The other eye, follow this eye. This showed that Sheena's peripheral vision is intact. I am now going to test cranial nerve 3, like I said, which is the oculomotor, as well as cranial nerve 2, the optic nerve. Sheena, I'm going to have you, I'm going to check for Perla light reaction and conversion. Sheena's pupils are reactive to light. They're about a 3. Sheena, I'm gonna bring my hands closer. As the object gets closer to Sheena's eyes, they do convert inward. I'm now going to check for cranial nerve 4 and 6, as well as cranial nerve 3 by using the EOM in the 6 directions. Sheena, can you follow my hands? Okay, during that time, I didn't notice any pososis. I didn't notice any neck stigma. And Sheena, did you see any double vision?
No.
And no diplopia? If there was any sign of diplopia, I would have Sheena cover one eye at a time to check if it's monocular or bimonocular. Now I am going to test cranial nerve 5, which is the trigeminal. In this, I'm going to test for motor and sensory. Sheena, can you open your mouth? Perfect. Move side to side. Sheena's jaw is strong. I'm also going to have Sheena close your eyes, and I'm going to check her um, axillary, maxillary, and her mandibula. Did you?
Soft. Hard. Hard.
Okay, Sheena's senses are intact. If it was abnormal, I would have do a cold, hot and cold. Um, I'm going to now check for cranial nerve 7, which is the facial. Sheena, can you smile, frown, lift your eyebrows up, puff out your cheeks? Perfect, that's intact. I'm going to now check for cranial nerve 8, which is her acoustic. I'm going to do that by the whisper test. I'm going to cover one eye ear at a time. 1, 2, 3.
1, 2, 3.
4, 5, 6.
4, 5, 6.
So Sheena's hearing's intact. She did pass with a 3 out of 6. If it was a 4 out of 6, I would further do the Renee or Weber test to sense for conductive or sensory hearing loss. Now I'm going to check for cranial nerve 9 and 10, which is the glossopharyngeal and her vagus nerve. Sheena, can you open your mouth, please? Say ah. Her voice sound is normal, no hoarseness. The uvula is at midline. Her pharynx is midline. Sheena, can you stick your tongue out? Tongue is symmetric. Can you move it side to side? There's no atrophy. There's no abnormality. I'm now gonna, the tongue is cranial nerve 12, which is the hypoglossal. I'm gonna check for this cranial nerve 11, which is the spinal accessories. Can you shrug your shoulder? Perfect. Doing cranial nerve 2, I can also check with a ophthalmoscope to check for the fundi which would be the optic disc. I am now going to, part of the neuro exam was to check for sensory, which is done by using the dermal tones. I'm gonna have Sheena close her eyes. Let me know what you feel.
Soft. Soft. Hard. Hard. Soft. 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 Soft.
Okay. If this wasn't intact, I would use hot and cold. I can also use the vibration test. And if I check the lower extremity, if that's normal, I can expect that the upper extremity to be normal. I am part of the neuro exam. I'm also gonna test Sheena's function, her mental function. Sheena, I'm gonna spell a word and I'm gonna have you spell it backwards. The word is world, WORLD.
DLROW.
Okay, and can you list 5 presidents for me, 4 to 5 presidents?
John F. Kennedy, President Lincoln, Bill Clinton, Donald Trump, Barack Obama.
Okay, and this completes my exam on Sheena. Thank you.